Sean!
Hi.
Hi, I'm Evan.
Hi, nice to meet you, Evan.
I am a nursing student at OU, and I was wondering if I could follow you around today and do some shadowing through your different patients.
Oh, that's fine. That's good, Evan. Actually, you can follow me. I just got a new patient in room 4 over there.
Oh, okay.
Okay, so the first thing we do, we call it the pre-interaction phase, Evan. We're going to go ahead and, on our medical record here, we're going to pull up the chart on the patient, and we're going to look at any procedures they had, their vital signs, allergies, medications, all that stuff, so we get a good idea of the, kind of like a pre-assessment to the assessment.
Oh, okay.
Then we're going to talk to any other caregivers that are with them or any caregivers that they have in the chart. You know, obviously our physician has to go in and see them also. But we put them in a private room, and I kind of saw them walk in, and mom is with her, so we can obviously make sure it's okay if mom's there. We'll see her age. Obviously, we have that in the medical record. So we'll kind of give them a private setting in the private room. That way they're comfortable sharing information and stuff, okay?
Alrighty, sounds good. Let's hit it.
All right, let's go. Knock, knock, knock.
Hi.
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 My name's Sean. I'm the nurse here in the ER.
Sean.
Could you tell me what's going on today?
This is my daughter, Carrie. I think she's 19. She is deaf and has been since birth. She does read lips. She's in a lot of pain right now, so.
Oh, okay. And where's the pain located?
It started in the middle of the night, in the middle of her stomach, and it seems to move to her lower right side of her stomach
Okay.
right now.
Okay. Have you noticed any diarrhea?
She has had some diarrhea, yes.
Has she? Okay. Any vomiting at all?
That too.
Okay. Can you have her show me where the
Yeah.
pain is on her stomach? Okay. So right there, right where it's on. Okay. How long has it been going on for?
Started about 3 in the morning, and now.
Been getting worse?
Yeah, it's progressively gotten
Okay. Has she been running a fever at all?
slight, about 99. I haven't checked it in hours.
Okay. Is she taking medication?
She does not.
Any allergies? Anything?
No.
Okay. So I'm going to go talk to Dr. Gray. She will be the doctor taking care of you today.
Great,
She'll
thank
probably order some tests and stuff like that, some blood work. We'll probably do some, CT scan, possibly.
Okay.
We'll get her pain under control. That's a priority.
Good.
And we do have an interpreter available. I know you
Okay.
probably interpret for her usually.
Normally.
But we do have a hospital interpreter just in case we have to do any, invasive procedures or anything like that.
I
Okay.
appreciate it, yeah.
All right. So I'll go talk to her and she'll come
Great.
in and talk.
Thank you.
Thank you, guys.
Alrighty, Sean. So now where are we going?
So we just finished up the orientation phase, Evan. Okay, that's basically the initial interaction with the patient. The most important thing is we need to make them feel comfortable and not to be too abrasive. She was in a lot of pain in there, and obviously having that disability of being deaf could definitely make her feel very uncomfortable and scared with what's going on. So we do our primary assessment. We do all our nursing functions. We're going to do a complete assessment, get her medical history. That way, when we go to the physician, we have a complete picture we can paint for him. That's actually where we're going to head right now, Evan, okay?
Mm-hmm.
All right.
Alrighty. So who are we going to see?
We're going to see Dr. Gray, all right? And we're going to
Wait,
use
the Dr. Gray?
the Dr. Gray.
Holy crap.
I
You
know.
guys are never going to believe this.
I know, deep breaths.
Okay.
All right. So we're going to go talk to Dr. Gray. We're going to use S-bar, Evan. Do you know what S-bar is?
Yeah.
Do you?
No.
No? Okay. S-bar is a handoff method, basically. So we're going to give Dr. Gray the situation, the background, the assessment, and our recommendation if she wants it. She usually doesn't.
Ah, okay.
All right, let's go.
Okay.
The results should be in soon. Okay, bye. What can I do for you, Nurse Sean?
Hey, Dr. Gray. Hi. Hi, I'm Evan.
Nice
It's
to
really
meet you.
nice to meet you.
Nice to meet you.
Holy crap, that's her pen. All right. Okay, no, I'll be over here. Don't worry about me, guys. All right, go ahead. Continue with whatever you're going to say. Okay.
In room 4, we have a 19-year-old female, Dr. Gray. She comes in complaining of abdominal pain today.
Okay.
She did point to it. She is deaf, so mom is a primary interpreter. We did have her point to it. It is in her right lower quadrant. With that, it's been going on since about 3 a.m. It's been accompanied with some nausea, some vomiting. She's very uncomfortable. She rated her pain a 9 out of 10 right now. So I did my primary assessment. She doesn't have any. She doesn't take any medications. She doesn't have any allergies right now. And that's pretty much it.
Okay, Nurse Sean, this is what we're gonna do. I'm gonna go in there and assess her.
Okay.
In the meantime, I need you to draw blood from an IV.
Okay.
And I also need you to start a CT scan, get that done.
Okay.
and I'm going to call an interpreter because we have to do that.
That'd be great.
And that's about it for now. And it looks like her signs that you've showed me is appendicitis, but we're just getting it all figured out with the CT scan and the results.
Excellent. Okay,
Okay.
I'll go tell them know what's going on.
Thank you so much, Nurse Sean.
All right.
I'll see you soon.
Thank you, Dr.
Bye, doctor.
Bye.
Holy crap. All right. So now where are we going?
All right, so now we kind of handed off all the information to Dr. Gray. So we're going to go back in there and we got to let her know what's going on. We're kind of transitioning into the working phase of it. That's when we're going to go ahead and explain the situation, explain what we plan on doing, and Dr. Gray obviously is going to come in and assess her too. So we'll get all that done and we're going to head on into the working phase.
Nice. All right, let's go.
Hi, guys.
Hi.
So I talked to Dr. Gray. I told her everything that's going on here. She said she is going to come in and do an assessment on Gary, okay? And she's also going to order some blood work. We're starting IV. Then we're going to take her to CAT scan after that, okay?
Great.
So I'm going to step out, give you guys some privacy.
No, she is in a lot of pain.
Is she?
Yeah.
Oh, that's not good. Well, I talked to the doctor. I let her know we can get her some pain medication once we get the IV in.
Okay.
Okay.
Yeah, thank you.
What is it right now on a scale?
I believe she's right up there, probably 10. She's also really scared, really anxious. This is her first time in the hospital.
Okay, all right. Well, let her know we're gonna take care of everything, okay, Mom? I'm gonna give you guys some privacy.
Thank
I'll
you.
have, are you okay getting her in a gown, Mom,
No
or do you
problem.
need some help?
I
No?
don't.
Okay, all right, so I'll close this curtain up, give you guys some privacy. If you need anything else, let me know, okay? If you have any questions or anything, I'll be right outside, all right?
Great.
All right, thank you.
Thank you.
Alrighty, Sean. So what's the next step?
Well, we just started the working phase there, Evan. So the next step is we're gonna get her to, we're gonna draw her blood, do all that, and continue on with our working phase here, okay?
Okay. Just a quick question. You were very reassuring in there, Sean, about the outcome of all this.
Well, Evan, you don't want to be too reassuring because that would be false reassurance. We're not sure what's going on, so we shouldn't tell her something that we don't know. That's something called a barrier.
Oh, barrier.
Mhm.
What are those?
Well, barriers are basically blocks in communication. Basically, it hinders communicating what we need to the patient. And providing false reassurance right now is not good. It's going to create a bigger gap if what information we are giving them is false.
Okay, so if that's a barrier, then what's something that we should be doing?
Well, if you saw two things, there's verbal and there's nonverbal communications. That we call them bridges. Bridges are basically the opposite of barriers. They're connecting you and your patient. So a nonverbal one is I made appropriate eye contact with her, and my facial expressions were appropriate. I was serious. I wasn't taking the situation lightly. Another one was I was providing information. That's a verbal one. I kept her and her mom up to date with what tests we're going to do and what they can expect. Obviously, she's nervous, she's uncertain, so we need to put them at ease, Evan, and let them know what we're doing and that we're here to help them. And if they have any questions or anything, we're there for them.
Okay, I mean, that makes sense.
Yeah.
All right, so now tests.
Tests, well, we're going to draw our blood. We're going to start an IV on her. We're going to put a saline lock in. Dr. Gray's getting our orders, so we have to have orders before we do anything. So we'll get an IV, draw our blood, and then we're going to take her to CAT scan after that. We also have an order for an interpreter. We need an interpreter, Evan, because we cannot have the mom interpreting the whole time.
And why is that? Now that would be a barrier, right?
Well, it would be, yes, but it's a barrier because the hospital policy is we have to have an interpreter from the hospital when we're explaining procedures to them.
So it's more of a legal thing.
Kinda.
All right, cool. Well, let's get started.
You know what, Evan? Now that you know what barriers and bridges are, can you tell me what is one barrier I used back there?
No.
When I said, how's her pain doing? I replied after she told me that's not good.
Now, why is that a barrier?
Well, that's that's approving or disapproving. I was disapproving there. So I was kind of letting my own thoughts and reflections get to the mom, and that's not good. That's going to create a barrier in our therapeutic communication.
Oh, all right. So that's like a big no-no.
Yeah, we shouldn't do that.
Okay, sounds good.
Carrie, you're over in pre-op now. This is Abby. She's going to be your nurse over here. She's going to be taking care of you, okay?
Hi, Carrie. Just press your light if you need anything, okay?
All right, Sean, so what was that?
All right, Evan, that was the termination phase. As you can see, Nurse Abby used the sense of touch to establish a helping trust relationship with the patient, which is part of Watson's theory of care.